experts to now speak about the program and what we are going to do and what the work flows. So thank you very much for listening to me.
I would now like to call our pulmonology expert, Dr. Pawan.
Hospitals. This is a lung cancer screening month, and we are here to talk about lung cancer screening. लंग कैंसर स्क्रीनिंग का मतलब क्या है? लंग कैंसर को जल्दी डिटेक्ट करना इन रिस्क पॉपुलेशन. As sir has mentioned, tobacco smoking सबसे ज़्यादा जो इंडिया में बीड़ी सिगरेट पी जाती है, उसके कारण patients are prone for cancer, and we want to catch hold or detect these cancers in early stage to offer cure. So Apollo Hospital has always been a pioneer and leading countrywide, worldwide to establish a world-class healthcare center across the country in India. So we take this opportunity and get lung cancer screening to India. As sir has mentioned, US, UK, for that matter, China and Taiwan have their own lung cancer screening programs. So why India should lag behind? And looking at the population burden and smoking burden what we have in our country, it becomes essential to have such kind of program. And I'm privileged to be part of such lung cancer program at Apollo hospitals. We call it as LungLife screening program because detecting lung cancer definitely adds more years to patients' life, gives them fruitful life. So, lung cancer screening program, huge. Why we need this kind of screening programs? Because if you must have heard about lung cancer stage 1, any cancer which is stage 1 to stage 4. So stage 4 is advanced stage of lung cancer, advanced stage of any cancer. So lung cancer usually comes in stage 3 and stage 4. As a clinician, we see these patients mostly in advanced stages, not in early stage. Because early stage they don't present with symptoms, or their symptoms may be like that of any respiratory condition, like cough, breathing difficulty, or blood issue. It can be seen in tuberculosis as well. So these patients are missed. So to identify these patients early, the screening programs or a LungLife screening program like programs are needed. If you see lungs, if you identify lung cancer in stage 1, that is in smallest size, less than 3 centimeter size tumor, the surgeons will operate such patient and offer cure almost up to 95%. But if this patient comes in stage 4, they survive hardly 1 year or less than 1 year survival. That's why identifying these patients are incredibly and very essentially important. Which are these patients where this screening program should be offered? You go out and you offer it to which are the risk population. These are the mostly smokers. किसको ऑफर करना चाहिए? Those who are current and former smokers. Within 15 years of their quitting, somebody has stopped smoking, but still up to 15 years they are at high risk of developing a lung cancer. Who's been a chronic smoker? दिन में एक cigarette pack for 20 years, who has smoked are definitely at the highest risk of lung cancer. That is called as more than 20 pack year history of smoking. Who has been current or former smoker and has quit within 15 years of age are the highest risk of developing lung cancer. Apart from that, somebody who had a family relative, first degree relative, father, brother, sister who had a history of a lung cancer, these are the patients are more prone for developing cancer and they are called as the risk population. So we have to identify actively this risk population and consider them for screening program. So the center to this screening program is called as low dose CT scan or LD CT scan. During COVID, you must have heard about CT scans of the chest. So it is a similar CT scan where we use X-ray radiation, X-ray beams to take better picture of the lung, to get the complete picture of the lung in 2 or 3 dimensions and identify these cancers in early stage. The advantage of a low dose CT, why it is called as low dose CT? Because the routine CT scan, what radiation dose is required is almost 7 millisieverts. But in low dose CT scan, it is 1.4 millisieverts. So it is almost 1/5 the time of radiation exposure to a patient compared to a standard CT scan. Roughly, it is equivalent to doing around 15 chest X-rays in one time. That is a low dose CT scan. It is very simplest technique. What it involves is there is no needle. We don't have to even put a needle to the patient. Patient doesn't have to be fasting. There is no contrast used. This is the simplest test where the patient walks into the clinic, identified as a risk factor, and referred for a low dose CT scan. Patient doesn't even have to change their clothes. A loose clothes without any metal body on surface are the patient's standard requirement. They come. The scan takes less than 1 minute, not even a 1 minute. And the scan will be read by expert radiologists. We have opportunity of having artificial intelligence at Apollo integrated with this system where an expert with artificial intelligence can give us better precision in identifying these lung cancer in early stages. Early stage means they are localized only to lung, they are not spread anywhere else, not in any other part of the body, so that these patients can be offered better surgical cure, better chemotherapy care. These patients will, the patients have to undergo annual CT scan. Low dose CT scan जिन्हें offer किया जाता है जो risk population, they have to undergo every year this low dose CT scan on a particular date. So if you find out any nodule, एक lung cancer जैसे comes as a small cell and becomes a mass, it takes around 26 to 40 doubling times. Doubling times means increasing in the number of cells to identify that thing. And majority of time they come as later stage, I said. That's why low dose CT scan will give us access to identify these patients earlier and offer them the cure. So as commonly this can be taken as a part of a health checkup package, what Dr. Nichols has pointed out, what we undergo a health checkup package yearly. We can use the low dose CT scan in a patient who has high risk or who's been a smoker. They can undergo complete health checkup along with lung health checkup and integrate a low dose CT scan. This is a voluntary scan. Patient has to ask for it. We will identify the patients who are at risk, but patient has to opt for it. And as I said, smokers, family relatives having lung cancer, they are the candidates. Patients are to be, we are training many pulmonologists, we are training GPs and enlightening them, teaching them about which are the candidates, which are the patients who are supposed to be sent for this kind of screening. Usually there is a patient navigator available at Apollo hospitals. So patients come to this navigator, these patients are taken to the OPD. The patients will be consulted by a pulmonologist, oncologist, surgeons and physicians regarding whether they are at risk of lung cancer or not. And if they are found to be at risk of lung cancer, will be offered voluntary screening with the low dose CT scan. And this low dose CT scan, suppose it finds the problem at a particular threshold, like if the tumor size or the nodule size has reached to 8 mm and more, and those patients are taken further for further evaluation, for biopsy, for sputum examination, for bronchoscopy and so on. And this is the simplest flow, simplest way, most cost-effective treatment can be benefited with the help of a low dose CT scan. Thank you.